Welcome to the topic immune system. You will also learn the immunology partly in microbiology and partly as a separate subject as immunology. What is important from pathology point of view, I am going to tell. So in the first topic, subtopic, we will see the basic concepts of immunity. The immunity as such, it has been divided into two entities, that is innate immune system and adaptive immune system. So let us see what are the components of innate immunity and what are the components of adaptive immunity. At this particular point, can you tell immunity is useful or harmful? Yes, remember, immunity is a double-edged sword. And if at all it is useful, how much immunity is required? Immunity is a double-edged sword. Immunosuppression makes a person, a humans, easy prey for infections as well as even tumors. That's what happens in patients with immunocompromised status like HIV and AIDS. They are very much prone for variety of opportunistic infections as well as tumors like lymphomas. Exaggerated immune response, so called as hypersensitivity reaction, is also fatal. Fatal allergic reactions for a simple bee sting bite. So they can prove lethal. Both immunosuppression as well as exaggerated immune response, hypersensitivity reactions. So that's why both are not good for human beings. So perfect balance should be there. How much amount of immune system is required is very, very difficult to label. We have one more, a subset of immune disorders, so called as autoimmune disorders, which are really challenging entity to treat. In these autoimmune disorders, patient will have autoreactive T lymphocytes, where our own self antigens and tissues are recognized as foreign, and our own immune cells will keep on fighting against the tissues. So these are a subset of disorders of immune system, so called as autoimmune disorders. So in this particular chapter of immunity, we will learn about immunodeficiency disorders, variety of hypersensitive disorders, as well as autoimmune disorders. The two types of immunity as such. First is what we are born with. It is called as natural immunity or native immunity or innate immunity. This is a defense mechanisms that are present even before the onset of infection itself. So they are first line of defense. They are not specific to any microbes and they are already ready in a body before even the infectious agents enters into the body. We have more stronger immune system, so called as adaptive immunity, which is also called as acquired immunity or specific immunity. These are the mechanisms which are stimulated once the microbes enters into the body and our body gets recognized by these microbes and capable of also recognizing sometimes non-microbial substances, so called as antigens. So this is the immunity that develops after the infection. So it is very specific and more powerful as compared to the innate immunity. The components of innate immunity, which is the first line of defense, consist of four things. One is the epithelial cells. When I use the word epithelial cells will exist in many forms in the body. For example, skin is covered by stratified squamous keratinized epithelium. The respiratory tract is lined by pseudostratified ciliated columnar epithelium. The GI lining is simple columnar epithelium. The urinary tract lining is urothelium, transitional epithelium. So all these epithelial cells are a part of innate immune system. So our surface epithelial cell barriers itself are very good defense mechanisms. For example, intact skin does not allow any of the infectious agents, microbes to enter easily inside the body. What happens in a patient with the burns? There will be a loss of skin. That's why these patients are very, very much susceptible for microbial infections and it can result in septic shock in these patients. Intact skin is not only a good barrier, it does not allow even the HIV virus. It does not allow any other viruses to enter inside into our body. The second component is the phagocytic cells. When I use the word phagocytic cells, it is mainly the neutrophils and the macrophages. The two important phagocytic cells are neutrophils and macrophages. They are the part and parcel of the innate immune system. The third is the NK cells, nothing but natural killer cells. They are again a part and parcel of the innate immune system. The fourth is the plasma proteins and even complement system. So they are the four components of the innate immune system. As compared to that, adaptive immunity is the one which develops after the microbes enter into the body and our body recognizes these microbes as antigens. This adaptive immunity is more powerful in combating the infections. It consists of lymphocytes and their products. Their products means either antibodies or the cytokines. So we classify the immune system as such into two things. One is innate immunity, which is also known as native or natural immunity. Adaptive immunity, which is also known as acquired or specific, which is of two types, humoral and cell-mediated. When you use the word humoral, it's mainly mediated by B lymphocytes, which will themselves convert into plasma cells. So what is plasma cell? It's nothing but modified B lymphocytes. They are the one which will secrete the immunoglobulins or the antibodies. GAMDA, IgG, IgM, IgA, IgE. So they are the antibodies, different antibodies secreted by the plasma cells. Cell-mediated immunity mainly composed of T lymphocytes. Two subset of T lymphocytes, CD4 and CD8 T lymphocytes. So they will have attachment to the MHC molecules. CD4 will classically binds to the MHC class 2 molecules, whereas CD8 will classically binds to the MHC class 1 molecules. So let us deal with all these components. What is the role of the phagocytic cells? What are the different types of cells? What is the role of NK cells? What is the role of plasma cells and T lymphocytes? So let us get familiar with these cells as such before going in detail about the other concept about the immune system as such. Coming to the T lymphocytes, they are very important component of the cell-mediated immunity. Around 60 to 70% of the circulating blood lymphocytes are T lymphocytes. They are also seen over the paracortical area in the lymph node, and T lymphocytes are also rich at the periarterial or lymphoid sheath of the spleen, PALS. They have a peculiar surface receptor molecule, so called as TCR, T cell receptor, to which they will bind to the MHC class 2 molecules. So two subset of T lymphocytes you should remember. The most important is the CD4 T lymphocytes, also known as helper T lymphocytes. So see this summary of the T lymphocytes. CD4 T lymphocytes will classically bind to the MHC class 2 molecules. The CD4 T helper lymphocytes, they are again two types, T helper 1 cells and T helper 2 cells. T helper 1 cells will synthesize and secrete interleukin 2 and interferon gamma. Again, interferon gamma, you know, it's very important cytokine for attraction of the macrophages. T helper 2 lymphocytes secretes interleukin 4, interleukin 5 and interleukin 13. Interleukin 5 and 13 are very important for attraction of the eosinophils. CD8 T lymphocytes constitute around 40% of the T lymphocytes. They are also known as cytotoxic T lymphocytes. They classically bind to the MHC class 1 molecules. They secrete interleukin 2 and interferon gamma. MHC, don't think it is very much complex. In a simplified fashion, it is of three types: class 1, class 2, class 3. Actually nowadays there are only class 1 and class 2. The class 3 we have named it as complement system. So class 3 MHC molecules is nothing but components of the complement system. So we no more classify it as class 3. So class 1 and class 2. So MHC molecules are expressed over the class 1 molecules are expressed over the all nucleated cells of the body. Except RBC and platelets, all other nucleated cells will have class 1 MHC molecules. Again, it is subdivided into HLA A, B, C. They have two subunits, alpha and beta subunits, and classically class 1 molecules will bind to the CD8 T lymphocytes, cytotoxic T lymphocytes. Class 2 MHC molecules are expressed mainly over the macrophages, over the dendritic cells and other epithelial cells. And subset of class 2 is the HLA-D, which is having very important role, DP, DQ, DR. A lot of disorders have been described with a defect or a deficiency of these class 2 molecules. Class 2 MHC molecules, classically they will be recognized by CD4 T lymphocytes. So this is a summary of the MHC class molecules. Remember, CD4 T helper lymphocyte is the one which is master regulator, also called as conductor of symphony of orchestra. This is the one which is capable of secreting so many cytokines, and that is the one which is get hampered mainly in a patient with HIV and AIDS. Again, two subsets of T helper lymphocytes, CD4 T helper 1 lymphocytes, they secrete interleukin 2 and interferon gamma. Interferon gamma, as I told, it is very important chemotactic factor, it is very important attractant for the macrophages. CD4 T helper 2 lymphocytes, they secrete interleukin 4, 5, 13. 5 and 13 are important for attraction of the eosinophils. The cytokine influence not only the adjacent cells, B lymphocytes, macrophages and NK cells. So this is how the cells will communicate with each other with the release of variety of cytokines. This is the most important target in HIV infection. So CD4 cell is the one which is crippled with the HIV infections. Plenty of cytokines, as I told, are released by the T lymphocytes. As you know already, the cytokines are the one which are messenger molecules of the immune system. They are short-acting soluble mediators. They have three types of actions: autocrine actions, paracrine actions, and endocrine actions. Nowadays, a new concept of treatment is coming up with the recombinant cytokines, that is immunotherapy for the cancer patients. So, a lot of research processes are going on in the field of cytokine studies. B lymphocytes are the one which will develop from the immature precursor cells in the bone marrow. Around 10 to 20% of the peripheral circulating blood lymphocytes are the B lymphocytes. So in a peripheral blood, predominantly we see T lymphocytes, only around 10% or 20% are the B lymphocytes. But remember, morphologically you cannot differentiate B and T lymphocytes. You need immunohistochemistry markers to differentiate these two lymphocytes. The B lymphocyte rich area are the superficial cortex, lymphoid follicles of a lymph node, white pulp of a spleen. So these are the B lymphocyte rich areas. After antigenic stimulation, the B lymphocytes, they themselves converted into the plasma cells, and they are the one which will secrete the immunoglobulins, what we call it as antibodies. So remember, it is the antigen which makes the conversion of the B lymphocytes into active form, that is the plasma cells, which will secrete variety of immunoglobulins, IgG, IgA, IgM, IgD, as well as the IgE. The one more subset of lymphocytes apart from B and T lymphocytes are so-called as natural killer cells. They are very commonly seen with the viral infections. So if you have viral fever, you will see good number of NK cells in the peripheral blood. As such, they constitute around 5 to 15% of peripheral blood lymphocytes. Normal T and B lymphocytes will not have any granules in their cytoplasm. They are agranulocytes, whereas NK cells, they will have good amount of granules. So that's why the other name for these lymphocytes are called as large granular lymphocytes. So they are little larger than the small lymphocytes, and they show azulophoric granules in their cytoplasm. So whenever you see LGL, that is NK cells, you should think that patient either might be having tumor or a patient might be infected with the viruses. So they play important role in killing of the tumor cells, and they also show important role in the virally infected cells. The NK cells are positive for immunohistochemistry marker CD16 and CD56. So this is a role of NK cells. The NK cells are the one which will liberate a molecule so-called as perforins. These perforins are the one which will causes perforation of the virally infected cells. Virally infected cells are directly killed by the perforins, variety of enzymes that are secreted by the NK cells. Coming to the macrophages, which are a part and parcel of our innate immune system, the phagocytic cells, the most efficient phagocytic cell, it is a part of the mononuclear phagocytic system. So it induces cell-mediated immunity, and this particular classification, it is mainly for our purpose. Remember, innate immunity and adaptive immunity, we have classified under these headings. It is only for the sake of our learning. But as such, in a body, The phagocytic cells, they get activated by T lymphocytes, and T lymphocytes are activated by the macrophages. So there is a close cooperation between these two systems. So macrophages play also a role in induction of the cell-mediated immunity. That's what I wanted to say. They ingest protein antigens, they process, they present the peptide to the fragments of the T lymphocytes. So with the help of T lymphocytes, the phagocytic cells are able to do the phagocytosis. They have very important role again in the type 4 hypersensitivity reaction in the formation of a granulomas. They are usually get activated by interferon gamma. That is the one which is secreted by CD4 T helper 1 lymphocytes. They usually try to phagocytose the opsonized microbes, opsonized by either complement C3b or immunoglobulin G, IgG. So such opsonized particles, IgG coated microbes, are very tasty for these phagocytic cells. You should remember the different names of macrophages. In the blood we call them as monocytes. In the brain we call them as microglial cells. In the lung we call them as alveolar macrophages or dust cells or heart failure cells in a patient with a congestive heart failure. In liver we call them as Kupffer cells. In the spleen we call them as splenic sinusoidal macrophages. In the kidney we call them as mesangial cells which will secrete the mesangial matrix. In the lymph node we call them as sinus histiocytes. In the skin we call them as interdigitating dendritic cells. They are again a type of antigen presenting cells. In bone tissue we call them as osteoclastic giant cells. In joints we call it as synomyocytes. All are one and the same. They are different names at a different tissue levels. So all of them will do one function, that is antigen presenting. So they are called as APCs, antigen presenting cells. Whenever the bacteria enters into the body, especially the gram-negative bacteria, they carry a lipopolysaccharides. So macrophages will express receptors called as toll-like receptors. So there are various types of toll-like receptors, and the lipopolysaccharides will bind to these toll-like receptors over the macrophages. Once the LPS binds to the toll-like receptors, it sends a signals through the nuclear factor. So nuclear factor KBs get activated. That is the one which gives a signal for the macrophages to secrete variety of cytokines. Not only that, hydrolytic enzymes will be get released, reactive oxygen species will be burst out, and this all will aid for phagocytic cells to do the phagocytosis. My dear friends, at the end, you should remember that this particular classification, that immune system is classified under two headings, innate and adaptive. It is only for learning purpose. But in reality, all these cells are dependent on each other for their effective function. So there is a kind cooperation do exist between the different components of innate immune system as well as the adaptive immune system. T lymphocytes are dependent on macrophages. Macrophages are dependent on T lymphocytes. B lymphocytes, that is plasma cells, are get activated by T lymphocytes. So in that way, all the cells are dependent on each other for their effective performance. So that's what I want to mean here. There is a kind cooperation and they work together inside the body. So that is the basic concepts about the immune system as such.